This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Yep, perfect. Thank you so much. You have 20 minutes.
Okay, so my name is Brian Werner. I'm the Associate Program Director of Physical Medicine and Rehabilitation. Hold on, I'm not sharing the right screen, so I apologize for that. Share screen. Okay. There we go. I apologize for that. So I am the Associate Program Director of the Physical Medicine Rehabilitation Residency Program here in the lovely city of Las Vegas. We are part of the Sunrise Graduate Medical Education Consortium. So who are we? So we are part of Healthcare of America. It's the largest hospital corporation in the United States. It is also one of the largest residence and fellowship training sites in the country. We have over 5,100 residents and fellows nationwide who are trained and are in fellowships or residencies within HCA across the United States. We have over 300 residency and fellowship programs across 61 teaching hospitals across 16 states. And we have over 162 GME specialty programs. So HCA is one of the largest healthcare employers in the country. There are 186 hospitals in 20 states and over 244,000 employees. And we supply close to 5% of healthcare services within the United States. We were founded in 1968 and are number 62 of Fortune 500 companies. We are one of two PM&R residency programs within HCA. We were the first 4 years ago and have subsequently been joined by an HCA physiatry residency program in Florida. As part of our training institution, we are a citywide training program with a inner city hospital, Sunrise Hospital, a private hospital, Mountain View Hospital, and a VA-centered training program at the Southern Nevada Veterans Administration program here in Las Vegas. So we have three main locations and truly are a citywide training program. So as I mentioned, we have three main hospitals. The Mountain View Hospital has 425 beds and 54 rehab beds. We have an outpatient rehabilitation clinic, and this is where our graduate medical education program is housed. We have the VA Southern Nevada Healthcare System, which is a 96-bed hospital with comprehensive outpatient PM&R clinics and a multidisciplinary pain service. In addition to that, we also have Sunrise Hospital, which is closer to downtown Las Vegas. It's 692 beds with 42 acute rehab beds, and also has Sunrise Children's Hospital with 4 pediatric rehab beds. We are affiliated with UNLV, which became an independent medical school separating off from UNR about 3 years ago, and they have their first graduating class finishing up this year. We have institutional agreements with the local osteopathic school, Touro University, and work closely with them in cadaver dissections yearly and have multiple medical students on elective rotations with us. The mission for our residency program was to provide comprehensive PM&R services to the population in the Las Vegas community, which did not have PM&R services, and to promote the general health of the population, including disadvantaged population and disabled persons. We also wish to provide hands-on education in an environment that emphasizes excellence in collaborative, evidence-based patient care and using a team-based approach to learning. We hope to build a multicultural academic environment that inspires the next generation of doctors and attracts medical students and physicians from all over the world. We hope to train physicians to develop an expertise in the area of PM&R to become regional and national leaders. So what's unique about us? As mentioned previously, we are the only training program in the state of Nevada. We were the first PM&R residency program in the HCA healthcare system. We have devoted faculty who've worked in academic, private, and public healthcare settings. We have attendings with a very diverse background. We live in one of the most culturally diverse cities in the country. There are 4 separate cities within the Las Vegas area that have been ranked top 4 cities most culturally diverse in the United States. We use an emphasis on hands-on learning. We have a state-of-the-art simulation center. We have over 8 ultrasound machines in use in all the clinics, so residents can get hands-on daily training. We have high-fidelity mannequins for simulation-based patient management that residents can take advantage of during normal hours and off hours. And we have a joint and spine injection model. We have a motion analysis lab in our outpatient clinic, and we have abundant resources and opportunities for clinical research and procedural skills development. We're also heavily invested in residents' well-being. There is a $7,000 stipend for the residents to use yearly for dinners and social outings. And we have fellowships in the development. We have 2 fellowship positions that have been earmarked for the PM&R program for a combined pain medicine and sports medicine fellowships. So this is a picture and a description of our core faculty: Mountain View Hospital, Sunrise Hospital, the graduate medical education offices, and the VA. It lists where they have trained, and you can see we have a diverse background of people and training experiences for the residents to take advantage of. Here is a list of our current residents. They are the heart and soul of our program, and they bring a lot to the table in terms of helping each other and training each other. And I don't think our program would be where it is today after just a short history without their input and involvement on a daily basis. So we just had our first graduating class, as we are only a program that's four years old, and they did quite well in continuing their education and moving on. Dan Wynn is going to a Virginia Sports and Spine Fellowship program. Michael Hansen was hired as faculty here at the Las Vegas VA in the PM&R department. Joseph Hill is attending a Sports and Spine Fellowship at OSS Health. Dennis Wynn is doing a pain medicine fellowship at Johns Hopkins University, and Anna Kone is doing a pain medicine fellowship at Wake Forest University. The residents did provide significant feedback in creating our rotation schedules. We've moved from a 12 rotation based schedule to a 13 slot based rotation schedule based upon their wish to move to 4-week rotations. And we use their input to increase elective and selective time, doubling our elective and selective time from the previous year to the upcoming year. We have robust core educational activities. We have 1 week of orientation at the beginning of residency where they're under the tutelage of 4th-year residents to learn the system. We have core didactics weekly from 1 to 5 p.m. on Wednesdays. There is catered lunch to all of those core didactics, and the residents get to pick where they want the lunch catered from. We have journal clubs, grand rounds, and workshops based upon the needs of residents. And, since we are a new program, the residents have been instrumental in shaping and designing the residency program to better meet their needs. Our educational goals and scholarly activities include journal clubs, case conferences, board review topics, simulation labs, and workshops. We have conferences and committees where we've had residents sitting on national committees. Anna Kone was a part of the inaugural HCA resident faculty transition program, where residents were trained in administration skills with the goal of moving into administration positions within the HCA healthcare system. Dennis Nguyen was an education committee member for the AOC PM&R. We have clinical research and scholarly activities that are available. We have research design and database analysis people available to review the quite extensive data within the HCA healthcare system to do novel research projects. We do quality improvement projects that are mandatory and research activity, including working with IRB through HCA Healthcare, and poster presentations and publications. With any poster or presentation that's submitted that is accepted for a national conference is paid for, the residents' attendance is paid for. We have PM&R specific educational resources, including paying for the memberships for PM&R and AAP for residents. We provide stipends for one conference during the PGY3 and PGY4. And that does not include if you do submit a poster, because then it is covered in addition to that. We have other resources available for national conferences with approval from the program director. We provide a stipend for board review course for our PGY4s. We have access to web-based board review questions and board vitals, and along with stipend for educational materials. It is a really generously and well-funded program, for the residents to make sure they have resources. So the residents' progress, these are pretty standard, I think, across all programs, so I won't spend too much time on that. We've had quite a bit of scholarly activity for a new program from our residents. These are the peer review articles, chapters, posters, and book chapters that have been written and published by faculty and residents in the last 2 years. We have ongoing research projects from the current residents. And we have, future goals, and short-term and long-term goals for our residency program. The main thrust of which is building the PM&R infrastructure within Nevada to meet the needs of our stroke, spinal cord, and brain injury patients. We have quite a lot of involvement with all the sports activities in town, including NFL, USC, regional tournaments that occur here that all the residents have attended and worked at. Like I said before, we are very dedicated to resident well-being. There's a $7,000 stipend for dinners. You can see the picture of one of the dinners above. The residents get together and do hiking and activities away from the training program. There's no overnight call, no weekend call, and we have resident and faculty people involved on a facility-wide resident well-being committee, not just committed to PM&R, but the PM&R involvement has been leading the way for all the other residency programs. So I'm going to let Hillary Toole, who is one of our PGY4s and chief residents, go ahead and provide some slides from the resident perspective.
Hi, everybody. So I'm Hillary. I'm the chief resident, like Dr. Warner said. So this is a really great program. One of the great things about it is the food. You never think to ask that, but you could tell a big difference when you have it and when you don't. So we have lunch provided every week, like he said. We get $150 to spend at our Mountain View cafeteria every 2 weeks. We get a daily lunch stipend while we're at the VA. And while we're at Sunrise Hospital, we can use the physician's lounge. And so once you're able to use all that money at the hospital, you can save it and then you can go out to eat on the strip and then really enjoy yourself. In Las Vegas, we have a lot of entertainment here. So there's the EDC Festival for those of you who are into music and EDM. There's the NFL draft that we had this past year, and there's always some kind of new sporting event to go to. And then we often have UFC fight nights. And what's interesting about UFC is we actually have a connection with the doctor for UFC. So we might even be able to start participating as, sideline physicians on those fights too. And then just living in Las Vegas is pretty great. There's no state income tax. It's quite affordable for when you think about where you're living in such a cool city. And we're really close to California. And then even if you're not really big on the strip, then you can go hiking or, go skiing. There's a lot of different outdoor activities to do here. So I think that's it. I just want to impress upon everybody listening that this is a really great program. We have really supportive faculty. And even though it's relatively new, you can see all the changes being made for the better because our faculty listens to us and tries to help us all grow. So thank you. Any questions?
5-minute warning. We have 5 minutes for questions. If you want to type your question into the chat, I can read it. Otherwise, feel free to unmute yourself.
Hi, can you hear me?
Yes.
Hi, I just had a quick question. I know we talked about, or it was mentioned how one of the changes that was made was a transition from like the 12 blocks to like a 13 block schedule. So it's 4 weeks each. I was wondering if you could give other examples since it's a newer program of other changes that have been made recently, just given the feedback that the residents have provided. Thank you.
The biggest, well, I'll start. The biggest thing is the schedule. So we didn't have a lot of elective time. I think we only had about 4 weeks, or maybe it was, I think it might have been 2.5 weeks. It was not a lot. And so we went from that to 6 weeks of elective time. In addition, we've added new electives. So we're working with Dr. Davis, who is a prominent sports medicine physician. In addition, we can work with Dr. Davidson, who is the UFC physician. And then we've added a new interventional pain elective with Dr. Park. So those are some of the changes we added from as requested from the residents. Oh, and one more thing. So we also added the inpatient senior rotation. For those of us like myself who are interested in going into general inpatient physiatry, this gives them a more hands-on look at how to run the unit as an attending. And that was also just a request from last year that we've newly added this year. Okay, thank you for the program. So Zach asked us if we accept IMGs. Absolutely. So our previous chief, Dr. Anna Kone, was an IMG. She went to University of Guadalajara in Mexico. And then she went on to do she's starting her pain fellowship at Wake Forest. So yes. Kamaria asked if there are any qualities that make applicants stand out for this program. Any qualities that make applicants stand out for this program? I guess I'll let Dr. Werner talk about that.
Yeah, I think we're looking for someone who is really invested in the specialty and wants to go into general physiatry. I think that would stand out in our mind in trying to meet the needs of the local community. You know, we have a large population, like I said, of spinal cord, stroke, and traumatic brain injury that have been chronically underserved in Las Vegas for many years. And so we are hoping to attract and retain people who want to practice general physiatry and improve the quality of care in Las Vegas.
Raquel wanted to know, would the Sports and Spine Fellowship be available by the time incoming graduates complete their residency in 2027? That's tough to say. We know for sure. You think it, okay.
Yeah, I mean, we've recently been told that 2 fellowship spots have been earmarked. And so it really depends on the application and approval process. So it shouldn't take more than a couple of years.
So Akbar says, for the intern year, does the program secure any TY positions if we match to the program, or is it still treated as a separate application?
We have several residents who do their transitional year at Mountain View. As you can see on the slides, we had 3 this past year. We had 3 the year before that. And then the first year we had 1. So 3 in the last year have done their transitional year here at Mountain View Hospital.
But do we specifically secure the spots? Like after we know they've matched with us? That's one thing that I'm not sure that we actually do.
Yeah, I think there is some preference given to it. We're not allotted a specific number, but if you look at the track record, we average over 2 spots a year over the last 3 years.
Well, thank you so much for answering these questions. I'm really happy we had time for that.